everyone, this is Moonshine's Curiosity. I know it's been like a year since I updated, and I figured I should update. I didn't update for a long time because just a lot of things happened, and then I got uncomfortable updating, and I guess I should just start. I don't know if any of you care about the update or if any of you were curious, but if you were curious about what happened to me, no, I didn't die. I'm still here. Nothing horrible happened to me. I mean, there were things that, you know, did disappoint me, but, I'm just going to have to work from there and just get better with time. And just hope for the best. So, around November last year, I was doing fantastic. I was on 400 milligrams of lamotrigine, which is an experimental kind of dosage for Lamictal. Most times, Lamictal is prescribed around 100 milligrams to 200, 250 milligrams for mood stabilizing properties. But 400 seemed to work fantastic for me. So it was on 400 milligrams of that. If you go above 400, it becomes an anti-seizure medication. So the doctors were quite confused on why 400 was working for me, but it was working. So I stayed on it. I was on... I'm trying to think how much I was on Abilify. I was on Abilify at the time. I can't remember the dosage exactly, but I think Abilify is a lower dosage than other antipsychotics. So I want to say it was 30 milligrams. But I could be wrong. I've been on a lot of antipsychotics in the last few years because they either didn't work, I got bad side effects that I couldn't live with, or things happened. So, if I can't remember specific dosages, you'll hopefully understand why. So, I was on that and I was doing great. And so my psychologist said, why don't you get back into working? And I was really scared too. She also got me back into driving and I was really scared too. But I started to drive again, and then I started working as a bus monitor for the school district, which is basically sitting on a special needs bus and keeping order on the bus. If one of the kids has a medical emergency, you flag down the bus driver and you take care of that medical emergency, being it a seizure, being it someone having a meltdown that you can't control, unless the bus is stopped. If someone is getting violent, they have all sorts of kids on those buses. Some of them are more behavioral problems. Some of them come from bad homes, and they're in programs to put them in better homes, so they're kind of like foster kids. So they act out in different ways. Some of them just have, special needs. They'll have very severe autism, or they'll have different mental disorders, or they'll have, deafness or blindness, or basically anything that would make them, a special needs child. So I did that until May. But in between that, I was seeing a nurse practitioner. I wasn't too fond of him, but I dealt with him. He was prescribing me my medications. Things were working out. I was able to get on my feet. Things were doing fantastic for me. So in February, one of the times I went to him, I I went to see him, but my boyfriend wasn't able to drive me. My mom wasn't able to drive me. So my boyfriend had his friend drive me, and his friend was really tired that day, so he slept in his car while I had the appointment with the nurse practitioner. And when I went in, the nurse practitioner was very aggressive. He told me that I was, that he knew I was faking my whole disorder, schizoaffective, that all I wanted was drugs, and that I just want to get high, which it's like, how do you get high on antipsychotics and mood stabilizers? Like, maybe mood stabilizers. I mean, I guess if you have too high of a dosage for like the first few days, you're gonna have like a manic state, so maybe that would feel like a high, but I'm I'm not abusing it. I'm taking it as I'm supposed to. When the doctor tells me, take this, take this medication at this milligram, I'm going to take it properly because I want to get better. I want to work properly. Well, he basically said I was just there for drugs, and for the last 3 or 4 months, every time I came in, he was doing a drug test on me, which I knew something was up. They claimed they had changed their regulations and that everyone had to get a drug test every time they came. But what I noticed is that no one else got a drug test before they went in, just me. So I thought that was a little bizarre. But then when that happened, I was really upset. And when I left, I didn't go back to him again. And I was kind of searching for a psychiatrist. It really made me lose my trust in doctors. Even now, I have a hard time trusting medical people because of that experience. And I think it's because, having that schizophrenic side to schizoaffective, I think that may be warping me to become more paranoid towards medical professionals, because I'm scared they won't want to take care of me or help me properly because they're going to think just like that nurse practitioner. But anyways, I'll continue with my story. So anyways, I dropped him, but I talked to my general doctor, who's a sweetheart, and I've had since I was 9 years old. So I've had him over 15 years. And I told him the situation. I said, can you just keep me on these medications? I can have the records forwarded to you to prove that he did have me on these medications, and that I just want my medications while I'm looking for a psychiatrist. And he said, sure. So I'm kind of looking through psychiatrists, and it's really hard to find a psychiatrist that in my area that will take me at this time. Most of them, and I don't blame them, most of them have a certain amount of certain illnesses they'll take. So they may take like a ton of people who are depressed, a ton of people with anxiety, and only take like 10 schizophrenic people and like 30 bipolar people, because those are harder situations to deal with. There's more medications that may work, may not work, because it's kind of a trial and error approach to helping what ails them. Because the medications are brain medications, mood stabilizers and antipsychotics are not really known how they work. They can theorize, they can kind of see what's going on with some of them, but oftentimes they don't know 100% what's going on in the brain. All they know is it can work on some patients, and other patients they don't work well, and sometimes they cause some bizarre side effects. So they don't like to take as many of those patients as other patients, which makes sense to me. So oftentimes a lot of them would say, oh, we're not taking your type of patient right now, or we don't take your insurance, were taking other insurances instead. I was just having the hardest time. Well, around May, I started getting tics. Now, a tic is like a motor movement, like it's a movement that you can't control, and it happens. Well, around April or May, I started having these like mouth tics, and what it was is I would keep moving my lips uncontrollably, and my tongue would move uncontrollably. And when this would happen, my mouth would get so raw it was hard to eat or drink because it was so raw. And I couldn't control my mouth movements, and I wouldn't even notice it because it was an uncontrolled movement. It was something, it would be like breathing, you don't notice it until you're like paying attention to it. It just happens. So I was concerned about it, but I didn't have a doctor, I didn't have a psychiatrist, I didn't have a nurse practitioner, I didn't know where to go. So I went to my psychologist again and I said, what should I do? And she said, I know an emergency place and they will probably take you. And they'll hopefully prescribe something. And it was also an inpatient place. So I go there in June because they start to get worse and worse. And I quit my job in May because it was getting worse. So I go there in June, and they tell me that I need to, well, they have me sign this paperwork, and then they take me back, and they tell me I can't see my boyfriend, and they go through my stuff, they take away everything, they're questioning me about why I have the stuff I have, which I'm a very eccentric person. When I feel more unstable, sometimes I carry a doll with me, and I had her in my backpack. And so they were questioning me why I had that. I'm too old to have that. And I'm like, well, when I'm unstable, I like to have my doll with me. Like, she makes me feel better. When I get upset, I can hold her. Like, it just makes me feel better. And they couldn't understand that. I mean, they were just kind of like messing with her and doing stuff that could break her because she's a ball jointed doll. So, I mean, they're pretty sturdy, but you can't just pull too hard on their arms where the string's showing and keep pulling. Ball jointed dolls are made out of string hooks and like ball joints. So they're held together by a string and hooks. So if you pull too hard, you could break the string and the whole doll's going to come apart. So I was pretty upset about that. Then they were asking for information. I told them I was schizoaffective. And then they gave me a breathalyzer. And I don't know how to use a breathalyzer. So they put it up to my face and they said blow. So I started blowing. I didn't know you had to put your lips on it. Like, I've never seen a breathalyzer used. I've never used one in my life, which I guess they expected me to know. I haven't even been pulled over in my life, so I'm a pretty good driver. And, like, I've never showed erratic behavior on the road. I've never had a cop, like, question my behavior to the point of needing a breathalyzer. So I didn't know how to use one, so I did that, and the person's like, you know how to use this, use it properly. And I'm like, you told me to blow, so I did. How do I use it? And he's like, put your mouth on it. And so I did, and then I blew into it. And of course, nothing came up because I wasn't drunk. I'm just schizoaffective. And they didn't even know what schizoaffective was. I was like, it's schizophrenia and bipolar together, essentially. I'm like, it's schizoaffective. And they're like, we're just going to put bipolar and schizophrenic. And I'm like, but it's schizoaffective. Put that in the system so the doctor knows what it is. But they refuse that. Then they put me in the lobby, and I just got really upset just because they were treating me like I was like this ingrate coming in there. And I found out later that it's used more for drug treatment than for mental health. That in the past it was for mental health, but now it's more for drug treatment. So maybe that's why they're treating me like scum, because they thought I was a drug addict instead of like a mentally ill person who wanted help. So I started crying, and like the staff didn't care at all. And then I finally got called back, and they lock the door so I can't even get out, and no one's in the room. And like I knock on the door and they're just talking to me through the door, and they're like, well, the doctor's gonna be on the TV screen. And I'm like, what? And they're like, just sit in the chair. And I'm like, okay. So I sit in the chair, and on the TV screen this doctor appears through Skype. And this Skype is terrible. They should have had her, like, I don't know if they need better internet or what, but I can barely hear her. I mean, she's breaking up in the Skype. So I try to tell her my symptoms. She can barely hear me. I can barely hear her. She has a thick accent on top of it. So it was very hard. And she was very irritated and angry for some reason, just like all the staff there. So finally, she prescribes me this medication that helps with tremors. And I found out later it's actually a Parkinson's medication, which you can use for motor tics that you get from antipsychotics. But sometimes it works, sometimes it doesn't. So, anyways, I'm able to leave there. They don't take me in. They give me my stuff back. I can leave, and I'm super upset. I just want to leave. So, for the next 2 weeks, I take that medication. I can barely talk. I can't complete my sentences. I'm forgetting things all the time. And I take it for about 3 to 6 months. Can't remember that time period very well. It was to the point I would forget things, that I would get angry about stuff because I couldn't remember having a conversation about important things. And then I'd think people weren't telling me things on purpose, and that they were basically scheming things behind my back. And so finally, after being on a waiting list to see this psychiatrist, my psychologist recommended, I see him, and he is very impressive with his records. So I go to see him, and I'm very distrustful at this point, and I can barely remember anything. I still have the motor tics in my mouth. The medication didn't help at all. It just made me forget a bunch of shit. And he tells me, you need to get off this ASAP. It's going to give you serotonin something, right? I don't remember. Basically, too much serotonin to the point that your brain blocks it, and then you're going to have a lot of issues. So he takes me off of that. He takes me off the Abilify, and we restart to the point of antipsychotics I've never taken before. And so it was back to square one. And he worked great. I mean, he tried some stuff that was interesting. He worked with me. He helped with things in my life that I felt were important that other doctors would have said that's not important, but he tried to help with that. So he dropped my Abilify to 100 milligrams. And then he what else did he do? I'm sorry. There was a lot of information I gave out, and now I'm not remembering it all. Then he put me on another antipsychotic. I can't remember what it was called. He put me on an antipsychotic. It didn't work for me. Then he put me on another one, and I was on that one for 2 months. And it was called, I think it began with an O something, olazapine. I think that's what it was called. I don't remember, but I got put on that one, and that one didn't work out for me, and I was on it 2 months. I would go into wanting to kill myself because I would be hungry all the time, and I would eat a meal and still be hungry and eat even more, and then I'd throw up and then want to eat more. And it was just this gluttonous feeling of wanting to constantly eat and never feeling satisfied. And I was gaining weight, and I was like, I can't do this. And he's like, well, can't you just hold out on it? And I'm like, I've been on it 2 months. I try to kill myself all the time. Well, I want to kill myself. Not that I tried, but I want to, because I am so hungry, I feel like I'm going to die. And he's like, okay, so then we try, I want to say it's a Z name. My memory hasn't been working well now, and I don't know why. I don't remember what it was called. It was another antipsychotic, and I was on that for a month, but then I would get in rages. People would say just one word that I didn't like, and I would try to beat them up. And I'm not aggressive. I don't, like, I'll get flustered, or I may not like someone for what they say, but I'm not gonna beat them up just for saying cheese, or because they said cheese the wrong way, you know, something stupid like that. But I would go into pure rage. Like, I talked to my psychologist, and I'm like, what do I do about this? And she's like, just go outside. Don't beat people up. You're going to get arrested. So I got taken off of that. And then the last one he had me try was one that began with an S. I always pronounce it wrong. It reminds me of a snake name, like Serpaline or something. And it's one that you put under your tongue. It tastes terrible. It's almost like, someone said online that it tastes like Godzilla's taint, which I guess you could say that. It has like a tingly, numbing feeling to your mouth. And it doesn't taste very good, even if it's flavored with cherry or any of the other flavors. Anyways, I took that for about 2 or 3 weeks. And then I started having issues like doing chores, like household chores. Then I started having issues walking more than 5 or 10 feet. I would just breathe really hard. I could barely breathe. I felt like I was going to faint. I would get tunnel vision. Then my chest started hurting. I started taking my pulse in the morning. It would be super fast. At night, it would be super slow. And so finally I called the doctor. I thought I was being a big baby about it. But then I told him about it. And even the nurse on the line's like, I don't think it's the medication. It's been too long for it to affect you. And I'm like, just tell the doctor. I don't care what you think. Tell the doctor. So then he calls me back, and luckily I did it in time because he was going on vacation like the next day for like 2 or 3 weeks, so made it in time. But what he told me was I was getting a heart arrhythmia, and that it was serious because this medication causes an arrhythmia that can cause a heart attack, because there's a ton of arrhythmias that don't. But this medication causes one that can give you a heart attack. And to stop it immediately, and if it doesn't get better in a day or two, to go straight to the emergency room and have your heart monitored. And so that was a little scary, but here I am, and it did get better. So, also I got nausea too when I would start feeling like I was gonna faint and couldn't breathe. I get huge waves of nausea, which I guess is a sign for your heart problems. So, yeah, he called it something else, but it's super serious. Less than 1% of people get it on antipsychotics. It's super, super duper rare. Like, it's like 0.02% of people ever get it on antipsychotics. And I had to get it. I had to get it. I was like, of course I had to get it. Of course. So then I had my psychiatrist basically said I tried everything that is out for this time for antipsychotics. I could try microdosing antipsychotics that I've tried, but he doesn't know if he wants to because of my severe reaction to the last one I had. And so then he retired the next month, and now I'm in between waiting for his next doctor to come in. Sorry, the lighting and my camera are not getting along. So I'm waiting for the new doctor to come into the office so I can get her, and hopefully she's nice. I don't know. I'm having a hard time trusting anyone at this point. So right now I'm on 3 mood stabilizers. I'm on, I think 50 milligrams of Topamax. I think it's 250 or 300 milligrams on Depakote and 100 on Lamotrigine. 100 milligrams. So he basically filled me up with mood stabilizers, hoping that stabilizing my mood may help my schizo side of things. But it hasn't really. It's like off and on I get super paranoid of people, or I just start distrusting things. I start thinking there's people or things in the walls or in open spaces in the house that we can't have access to. I just get thoughts that other people are like, no, that's not real, and it's really hard to trust in that. So that's been difficult. My hallucinations have been pretty much the same ones recently. I did get a new one. His name's David, and it was because I read a creepypasta, and I thought reading a creepypasta would be a way to get a little horror in my life, because as you know, I do love horror movies and things of that genre, but turns out there was a few pictures in it to kind of creep you out, and he became a hallucination, and I see him sometimes, and if I turn my back to him and walk away, he will run after me, and I will hear the pitter-patter of his feet as he runs after me. So that is not very nice. Oh, and another new one is I see the lady from The Ring. She will walk into a room and she'll either stop at a door or a wall and slam her head against it, and there'll be blood and just gross stuff, and then she'll slam her head for a while on whatever flat surface she can find, and then she'll fall down and stay in a heap on the floor for a long while and then disappear. So those are the new exciting hallucinations I have. The other ones have stayed pretty constant. Other than that, I did move in with my boyfriend. I have a roommate, and it's good. It's good. So I should be able to update more now. I was kind of scared to get back on YouTube because I was kind of embarrassed that I was doing so well and basically kind of fallen back. But, you know, that's the way it goes with us, I guess, you know. Things work and then they stop working and we just keep moving on. So the bipolar seems pretty under wraps. I think with all the mood stabilizers it has to be. But the schizo side of things, I can definitely tell without an antipsychotic, is a lot more haywire. During this in-between period between my psychiatrist retiring and getting the new one, they had me see a nurse practitioner in the office. She thought it was an autoimmune disorder attacking my brain. But the thing is I've had all the tests that she wanted me to do again for autoimmune systems attacking my brain. Like, I've had a bunch of scans, I've had a bunch of blood tests, I've had, like, everything done when I first started having issues, like, 4 years ago. So I told her that, and I also mentioned, like, when it's an autoimmune system, I would think that everything would happen like randomly. Like I would constantly change. Like, you know, my behavior would constantly change. My hallucinations would constantly change. Like nothing would be the same because the white blood cells would be attacking everything and causing different things going on. As I said, my hallucinations are very stable. I see the same things, I feel the same things. Like you know, all the things that I have for hallucinations are basically the same, unless they're new ones that happen once or twice a year. I'll get a new one occasionally, sometimes more, sometimes less. But the thing is I was like, my moods are on cycles. You know, usually I have mania or depression for a week or two, and then it slips into the other one. Like, it's very cyclable. So I was like, well, I don't think it's an autoimmune disorder because it would be less regulated than it is. I would be way out of control. I can have more control over what I have because I am aware of it. I do know what's going to come to some degree. When I'm manic, I know a depression episode's going to come within a certain amount of time. When I'm hallucinating, I know when I'm hallucinating because I've seen it many times before and know it's not real because I've asked, or I've tried to record it on a phone and seen that the phone doesn't have it, therefore it's not real. So that's just a few tidbits. Anyways, I'm going to let you go for now. That's been the update so far. So have a good day. I'll try to update more, and hopefully you enjoyed this. See you later. Bye.